Hey, it's a nursing professor here. I want to talk to you today about the musculoskeletal system, which of course is associated with movement. Now, I think many times we only think of assessing the musculoskeletal system when the person has a musculoskeletal injury, when in fact it is a system that needs to be assessed all the time. Because if you're unable to determine if someone, say, has the functional ability to be able to walk to the bathroom, then you have to know that they'll be incontinent, even though they might not tell you. But if you assess somebody and you see they can't walk to the bathroom, then automatically you know that there's some sort of incontinence going on. And of course, as we talked about in the integumentary system, then that means risk for skin breakdown. So let's get into it. When we talk about the musculoskeletal system, of course, we're talking about muscles, joints, tendons, range of motion, how well a person can move those parts, the cranial nerves, being able to assess the cranial nerves to make sure that they're innervating these areas to assess both motor and sensory function. We even have a little bit of mental status involved when we are assessing the musculoskeletal system because, again, anybody with impaired musculoskeletal system sometimes is a result of a neuro problem where the cranial nerves are not sending the signal to the body in order to be able to do what you want it to do. All right, so if it happens to any of us, and just think, if you, I don't know, fell on the ice, if you sprained your arm, if you did any of those things, you really don't know the importance of it until you don't have that body part to work with. And so it is so important that when we're doing an assessment, we're looking at symmetry, meaning one side mirrors the opposite side. Because when that symmetrical difference happens, again, you're going to come up with some sort of imbalance, which of course will put your person at more risk for falls. So let's move into assessment. We're going to take this by the nursing process. So assessment will include inspection, where we're visually looking at a person. We're looking for symmetry. We're watching them walk. We'll tell them to walk ahead and turn around and come back. We want to note any type of abnormalities, especially in their spine. Like, do they have curvature? Is there any kind of problems with their posture? Is one leg shorter than the other? Those types of things we're inspecting. We're also going to palpate. So many times people who come to us who have musculoskeletal problems, they will complain of pain. And so say, for example, if it was my shoulder, because I really do have a bad shoulder, is that, I would ask the person, can they raise their arm? And so even me with this bad shoulder, if you ask me to raise my arm, you clearly can tell that that's uncomfortable for me. I would also talk about or demonstrate palpation, where you're actually taking your hand and you're feeling that body part for any type of deformity, if there's any type of swelling or warmth, because that could be a sign of some sort of inflammation. We're also assessing for atrophy versus hypertrophy. So remember, atrophy is when literally the muscle is wasting away, and it wastes away because it's not being used. All right, and any type of tenderness there. So pain does come into play when we're assessing the musculoskeletal system as well as the neuro system, because we want to assess both motor and sensory. It's important, of course, to assess a person's risk for falls, and usually what's the best way to do that is not ask the person, have they fallen? Because many times people will deny it. But what you can ask is a question like, how many times have you fallen in the last year or the last 6 months? And usually it'll get them thinking. And when you start to see the wheels turn and they're thinking, they've fallen. They just don't want to tell you. And usually they will admit it to you because that's more of a pointed question. All right. So you want to know about falls. You also want to make sure that you're maintaining privacy, because many times when we're doing an assessment of the musculoskeletal system, you know, people have on their clothes, so we're not closing any curtains or anything like that. And that is a violation of patient rights and HIPAA. So important part to walk away, directly ask them about falls when you are assessing a possible problem with the musculoskeletal system, and make sure you're maintaining privacy when you're actually doing your assessment. All right, so we do expect some changes with aging. So what do you think? The older you get, you're not running a marathon. Most people are not. You have a decrease in muscle mass. You have a slowing in speed and strength and reaction time, which is why sometimes when you're behind an old person driving, you're like, can I get around them? And no offense, because I'm of that big age, so, you know, y'all just come around. But they do have, these are things that do happen with aging. Thinning of the vertebral disc happen. And so many times people get shorter or they shrink just because those discs that provide a buffer or cushion in our spine, it starts to get smaller and smaller. And of course that cuts some of the height. All right, and of course, both men and women are at risk for osteoporosis, but women more so, and that is loss of bone mass. And many times the testing for that would be your bone density scans. And so actually, I think it's even a requirement underneath Medicare now that if you're over the age of 65, you should have one. All right, so that's the assessment. So what's next? Nursing diagnosis, mobility, risk for mobility problems, risk for falls, swallowing difficulties, because remember, to even swallow, you have muscles that allow that food to be digested. And so that could also show up, especially with your people who have a stroke. And then our plan, of course, is going to coincide with whatever deficit that person has. So if they have a problem walking, then our plan is that hopefully we can get them up and moving, maybe 10 feet, you know, but we want to make sure our plan is really measurable. And interventions would include putting the person on fall precautions to get physical therapy, occupational therapy, speech therapy, any of those rehab specialties involved. Pain management, if that person's in pain, they should have pain medicine or, you know, hot packs or cold packs or whatever will help resolve some of their pain. And of course, education, because as I always say, people don't live in hospitals, they go home. And so you want that person to be able to manage their discomfort when they are at home. That's going to minimize their risk for falls when they're not in pain. And then, of course, we evaluate, did we do good? Did we not? Did this person get it? If not, then we go all the way back to assessment. So when we look at the motor function of the body, a part of the assessment might be to ask the person to touch their nose real fast. Okay, the older someone gets, you will notice that this will be more intentional and it's going to actually slow down. Also, if there's any neuro deficit, it's going to show up. So quickly touching the fingers to the nose is one of the tools that you could use when you're assessing a person. Also, Romberg. Do you remember Romberg? Romberg is when you stand with your 2 feet together, your eyes are closed, and you expect a little bit of a sway, but not a whole lot of sway. And so you can start to see some deficits there. You might ask them to do heel-toe walk, where you take one heel and you put the other foot behind it. And so it's heel-toe, heel-toe. And you want that person to walk a straight line. It's the same kind of test that they do if you're suspected of drunk driving. And then, of course, assess their muscle strength. You're going to ask them to squeeze your hand, push against you, those types of things like that. Sensory. So that's part of your motor assessment. So let's get into sensory assessment. So with sensory assessment, we're going to do some tests like ask a person to close their eyes And then we might take a sharp and a dull object and touch them on different parts of their body and ask them if they're feeling whether or not it is sharp or dull. We will assess their temperature of their skin, because usually heat is an indication of inflammatory process going on. Assess their ability to feel light touch, like a cotton ball. You might want to, take a cotton ball and go against their face, have their eyes closed, of course, and then see if they can feel that sensation. Vibration, if you remember from the tuning forks, then you'd have a tuning fork and then you slap it in your hand, it starts to vibrate, and then at that point you can put it on different parts of the body. Okay, and then that person should tell you whether or not it's vibrating or not. And reflexes, you're going to use your reflex hammer and you would test the reflexes of a person. So that's going to give you all of the things that you need to know about the sensory system as it relates to the musculoskeletal system. So I got a question for you. All right. So we got a nurse. She's doing an assessment of an 80-year-old female. Which of the following findings should the nurse expect as changes associated with aging? Select all that apply. You'll notice I'm always going to give you select all that apply questions. Okay, 80 years old. We're looking for expected findings of showing that this person might be aging. Okay, so A is slower light touch sensation. Does that person have that? B is vision and hearing decline. C is slow fine finger movement. D is short-term memory decline. And E is slower superficial pain sensation. And so out of those 5 choices, then you should select those that would be the answer to that question. All right. Now, I didn't touch a lot on the short-term memory, but this is the thing. When you're talking about the effects of memory as it relates to someone's movement, musculoskeletal system, then it's okay for a person to be a little bit forgetful. For example, if you ask them during your assessment, well, where do you live? They should be able to tell you where they live. If you ask them what today's date is, they should be able to tell you what today's date is. If you ask them, say, what did they eat for breakfast this morning? They don't have a clue. Or what they ate for dinner last night, they don't have a clue. You might have a problem there. And then you would move into the mini mental examination that has a series of questions that will help to identify any type of memory deficit your patient might have. So we'll talk about that in a later video. So hopefully this helps. And put your answers in the comment section down below. And we'll see you next time. Bye for now.